We're discussing the respiratory system and some of the basic lung structures, and then we'll look at the histology slide at a microscopic view. When we cover the respiratory system, we've looked at different angles of how do we conduct into the lungs and then the respiratory zone. But let's look at the superficial structures at a macroscopic view. As I go through the larynx or the voice box, and I have a separate video that discusses the different cartilage pieces of the larynx, you can see this is an endocrine structure. That's my thyroid gland or my bow tie gland. As they come down the windpipe of the trachea, I can finally branch into my primary bronchi, which will lead me into my left lung and my right lung. And when I look at the left lung, it's slightly smaller because I got to provide room for the heart on the left side. It has two regions to it, the superior lobe and the inferior lobe, versus the right side, a little bit bigger. It has three lobes, superior, middle, and inferior lobe. They're separated by what we call fissures. I have one on the left side, and it's running at an angle, so we call it the oblique fissure. I can see oblique fissure on the right side, but I also have an additional fissure because I have an extra lobe running at a horizontal angle. I have horizontal fissure. These fissures help to organize the overall inflation and deflation of the lungs as we breathe, inhale and exhale. One of the also benefits, if we're sick, we can isolate some type of infection to one of the lobes. So I have superior lobe, inferior lobe on the left side, separated or combined, however you want to look at it, by an oblique fissure. On the right side, superior lobe, middle lobe, and inferior lobe. I have a horizontal fissure in between my superior middle lobe, and then another oblique fissure with my middle and inferior lobe. Remember, we said our left lung is a little bit smaller for the heart. So we have this indentation on the medial side of the left lung called the cardiac notch, referring to the cardiac part of it, the heart. So the heart fits in this region primarily on the left side. As I come down, I can see the diaphragm, that muscle that can control for inhalation. So the diaphragm sits below the lungs to help raise up and create that pressure, because we rely a lot on bulk flow as we push oxygen and carbon dioxide in and out of the lungs. And I can feel that with pressure. A lot of our processes rely on pressure throughout the body. So I created bulk flow, and it's creating that pressure inside, and I can feel it. And what I can feel is my body wants to equalize it. And it's forcing me to release it because I always want to balance pressure. But that balance of pressure is to our advantage because I can create the bulk flow that helps to efficiently move it by diffusion osmosis. And then I rely on pressure to push it all by way of a lot of it. So bulk flow. So that's a general overview when we look at the structures of the lungs. When we look at histology and open up inside of our lung, we're getting down to where we have the alveoli. And what I can see with the alveoli are all of these little bubbles throughout. This is a lower magnification, and I go into higher magnification. I can notice the alveoli because they're covered with capillaries. Capillaries are those very small blood vessels that we're using for the exchange of the gases at a respiratory membrane. And I have another video talking about the layers of the respiratory membrane of how we move oxygen and carbon dioxide back and forth across. So as I breathe in and breathe that oxygen, we're trying to pass through the alveoli to get to the capillaries and then exchange that carbon dioxide. So as I look at all these little white spaces and I pull one of these out, this is one alveolus for singular, so alveoli for plural. So any of these white bubbles we refer to as alveoli. And we can see them again because of the blood supply around them. And then they tend to open up. So you'll hear that sometimes we'll refer to these as alveoli ducts and sacs. A duct is like the road map to it, to where it ends up closing up. To me, it's like entering into a cul-de-sac. You drive down the road and it hits a cul-de-sac, the end of the road. The duct is the road that leads to the end point of the sac. So alveolar duct and sac is all part of the alveolar process. So I have my individual alveoli. And then this larger piece here is one of my bronchioles. Remember when we talked about our conduction zone or respiratory zone? We're getting smaller and smaller into the millimeters to finally hit our bronchioles that are supplying that tree to reach all these alveoli. And there's about 150 million alveoli per lungs. Remember, our lungs are not just balloons. They are not hollow. They're full of these alveoli. So they do expand like a balloon, but what's expanding is opening up these alveoli to absorb the gases. So I have alveoli, and if I expand on it, higher magnification, all these little bubbles, and then these are bronchioles. And then we tend to see some of our blood vessels that are mixed in with this. So this is histology of the lungs, and then we looked at the macroscopic view of some of the basic structures of them when we talk about the respiratory system.